Spring has sprung, flowers are blooming, and pollen is in the air. That means sneezing, congestion, and watery eyes for many. According to the Centers for Disease Control and Prevention, as many as 60 million people in the US suffer from allergies during certain times of the year and sometimes year round. In addition, as many as 30% of the general population suffer from red, watery, or itchy eyes. But what causes allergies and sinus issues, and when should you see a doctor? Hi everyone, I'm Daniela Contreras. I'm here with Dr. Kimberly Kinder, an ear, nose, and throat surgeon at Enloe Medical Center, to talk about this and more. Thank you so much for being here, Dr. Kinder.
Thank you for having me.
Before we start talking about allergies, can you tell us what are sinuses exactly?
Sinuses are air-filled spaces within the bones of the skull. We have sinuses in our cheeks, in our forehead, between the eyes. The sinuses make mucus, which then drains into the nasal passage or the nasal cavity, and that's the airway that allows air to flow from your nose down into your lungs so you can breathe.
What are some of the most common issues that you see people come into your office with?
So we see a lot of people that have both problems with the sinuses themselves and with the nasal passageway. So if you have a hard time breathing through your nose, that's more likely to be a problem with the nasal passageway. So that could be from the septum, which is the structure that divides the two sides of the nose, or the turbinates, which are other structures within the nose that help humidify and filter the air that we breathe. Sinuses, you can have problems like pain, pressure, infections, polyps. So it's quite a variety of things.
And what are some of the symptoms the most common symptoms that people experience?
Yeah, so a lot of symptoms that people have can have problems with breathing, problems with pain or pressure in different areas of the face, problems with their sense of smell. So when we hear these different problems, we try to figure out what exactly is causing that.
Some people may experience some drainage. Can you tell us more about this?
Yes, so the nose and sinuses actually make about 1.5 liters of mucus every day. So we all have a lot of stuff draining within our nose. So for most people, it just drains down the back of the throat and you don't really think about it. So even though it's kind of gross, it's just a normal process there. When people get an actual infection in the sinuses, the drainage changes and they actually get pus. And so pus is a combination of bacteria, white blood cells, mucus, and it tends to get thicker and it often has more of a color to it, like a yellow or green color. And really the easiest way to tell pus is that it actually smells pretty bad. So people can have a lot of different drainage that's normal, but if the drainage has a bad smell to it, then it's more likely that there's actually an infection there.
And sometimes we hear that some people feel congestion or pain, but they don't necessarily have drainage in their nose. What could that be?
Yeah, so that happens pretty often. So a lot of people get diagnosed with a sinus infection or what we sometimes call sinusitis. To have actual sinusitis and acute sinus infection, people have to have pus draining from their nose. So if you don't actually have any pus in your nose, it's probably something else. So it could be allergies or migraines or another issue that your doctor can help you figure out.
And what are some of the treatments that people can seek when they actually do have a sinus, like a sinus infection or sinusitis?
Yeah, so if it's actually a sinus infection, most of the time people will be put on antibiotics for that. Saline rinses for your nose and decongestants can also help with the sinus infection. If people are getting a lot of sinus infections or chronic sinus problems, sometimes they'll come to an ENT doctor and we might be able to do a surgery that can help clean out the sinuses.
Oh, wow, that's great. So now let's talk about allergies. What are they and how common are they?
So allergies are basically a reaction that happens from the immune system where your body recognizes dust or pollen or animal dander as something that it kind of wants to fight off. And so what happens is that the immune system has this process to recruit a lot of cells to the area, and then it releases all of these little chemical factors we call chemical mediators. And what they do is they cause all the symptoms we associate with allergies.
And what's the likelihood that someone will have allergies?
So allergies are pretty common. If people have a family member that has allergies, it's more likely that they'll develop allergies themselves. If you have asthma or eczema, those are also conditions where you're more likely to get allergies.
Sometimes when we have these symptoms, we don't know if it's a cold or if it's allergies. How can we tell?
It can be hard to tell because there's a lot of the same symptoms. So people can have sneezing, cough, runny nose, stuffy nose, itchy eyes with any of those things. If you have a fever or chills or body aches, that's more likely to be a cold or some other viral illness as opposed to allergies. Also, allergies really only happen when you're exposed to something you're allergic to. So if you're exposed to a cat or dust or pollen, that may be allergies. Whereas if you're around someone that's sick, it's more likely that you're sick and you can't really catch allergies from other people.
Okay, that makes sense. And then when should people seek help from a doctor?
So there are a lot of over-the-counter medicines that are available that people can use, but if that's not helping, or if symptoms seem severe, or if they're lasting for a long time, it can be helpful to go see your doctor.
When is the time of the year when people struggle the most with allergies?
So there are certain things people are allergic to year-round. So dust and pets, those are the whole year. Pollens that people are allergic to, it depends on where they live and what's in bloom. So Chico, with the mild winters, there's pretty much always something in bloom. So unfortunately, people here in Chico suffer with allergies pretty often.
Yeah, and how can people know with the different nasal problems that you have described, how can people know what they specific one have?
So it can be hard to tell sometimes. So you can always start by trying some over-the-counter things, but if that doesn't help, it's a good idea to see your doctor and describe your symptoms, and then your doctor can help figure out if you need a certain medication or if they should refer you to an ENT doctor or an allergist or some other specialist.
And you mentioned that surgery can be a way to treat them. What does surgery entail?
So there are different types of surgeries we do on the nose and sinuses depending on what particular issues people have. So sometimes if we're doing sinus surgery, we usually have to do a CT scan or CAT scan before that to be able to look inside the sinuses. So sinus surgery, we basically go in through the nose, there's no cuts on the outside, and we really open up the sinuses to clear those pathways for people. Other surgeries, if people are having a hard time breathing, we can sometimes straighten the septum or shrink down the turbinates. People can also have nasal polyps, which can cause both sinus and nasal congestion problems, and we can remove those with surgery too.
Is it an ambulatory type of surgery? Can they come and leave?
Yeah, so it's outpatient surgery, so people go home the same day. We do use general anesthesia for these surgeries, so people are asleep when we do the surgeries.
Is it a fast recovery or a slow recovery?
Yeah, so most people recover pretty quickly from nasal and sinus surgeries.
Oh, that's great. So was there anything else that I didn't ask that you would like to add?
Yeah, so the ENT clinic here at Enloe is always accepting new patients. So if you feel like you would like to see a specialist, if you're dealing with any of these issues we discussed, talk to your primary doctor, and if it's appropriate, they'll send you on to us. We're happy to see you.
Well, that's great to hear. Thank you so much for being here again, Dr. Kinder.
Thank you for having me.
And thank you so much for watching. Remember to talk to your provider if you're having nasal issues. And if you enjoyed today's discussion, be sure to catch Enloe's podcast, Health Matters. We placed a link to it in the comments field. Goodbye for now.